And I'm so happy scrunchies are back in fashion because I used to give the scrunchie talk and nobody knew what I was talking about. But the idea here is that your colon, which is kind of where the poop is held and where it will sit before it comes out, is a very elastic and stretchy organ. It's meant to stretch when it fills with poop, and then you will empty, you'll go to the bathroom, and it should shrink back down to normal. What happens in someone who's been constipated over a period of time, that's generally talking about months that you're now having changes, is the colon becomes like a scrunchie that's lost its elasticity. So you know that scrunchie that's now loose and floppy? It's stretched out, it's bigger, and then we have a couple of problems that happen secondary to that. And understanding those problems will really help you manage what you do after that. So the first problem is that urge, the kind of butt feeling that I need to go to the bathroom, will come when you have totally filled your colon. So if you have a colon that's stretched out 3 times the size of normal, and you have a normal sized poop, that child will not actually recognize urge to go to the bathroom. And that's what propagates this every 3 or 4 day bowel movements. The problem is, as stool or poop sits in your body, it gets bigger and harder. And then when you ultimately go to the bathroom, it's painful, uncomfortable, difficult to come out. So you're now reinforcing the problem because A, you often don't completely evacuate because they're hard to move. And B, that really causes behavioral issues because those children are having pain and discomfort, and then they start to do everything they can to hold their poop in. The second thing that happens is the muscles of the colon actually don't work at their optimal capacity when it's so stretched out. So you have a relatively weakened muscle, and so your ability to move things becomes impaired. And that all of that will improve. The best part of all this is if you can keep the colon empty consistently, it will shrink back down to normal, it will recover function. But that's a process that takes time. So when I say the biggest pitfall is people go on and off and on and off medicine, it's because they haven't actually really healed or rehabilitated the colon. And once you do, you're going to have lasting, ongoing success. And not every constipated child becomes a constipated adult, especially if you treat it early on.